Thank you very much, Chairman Jordan, for allowing us to have this hearing today on this very important topic. I really appreciate your cooperation and the cooperation of your staff. And thank you all for traveling from long distances to be here today. And thank you to the audience, people in the audience as well. I asked for this hearing today because opioid addiction is a public health crisis that has devastated neighborhoods across Illinois and communities in every state. Local communities are at the front line of this crisis, and Congress needs to listen to them. Today, we will hear from local experts who are addressing the horrific impact of opioid addiction and other substance use disorders in Ohio, West Virginia, and in one part of my district, namely DuPage County, Illinois. In Illinois, there are an estimated 180,000 people with an opioid use disorder. Every single day, I feel the impact this crisis has on so many of my constituents in DuPage, Cook, and Kane counties. In DuPage County alone, 126 patients died of heroin overdoses and another 108 from fentanyl just in the last 3 years alone. I applaud the $3.2 billion in new funding for opioid treatment that Congress passed this year. But Chairman Jordan and I need to know, is the federal government doing enough about this disease? Is Congress supporting you in the most effective ways possible to address the opioid crisis? We need to know if you have the flexibility to respond to opioids, because what works in one area is not necessarily what works in another. We also need to know if you require more resources for prevention, treatment, and rehabilitation of those suffering from substance use disorders. We need to know if law enforcement is going after big drug cases and not just arresting addicts. We need to know if current law enforcement practices are preventing addicts from seeking treatment for fear of legal jeopardy. The public health crisis of opioid addiction demands that we are committing sufficient resources and that we are spending them efficiently and effectively. It is critical to increase the supply and use of the highly effective opioid overdose reversal drug naloxone so that we can save the lives of those who overdose. We must ensure that first responders and others have sufficient supply to prevent overdose deaths in their communities. I look forward to hearing today about evidence-based prevention efforts that have proven effective, including what we know about addressing the root causes of addiction, and that's something that's especially important to me. I want to know what's working in terms of preventing opioid addiction in the first instance. I look forward to hearing about effective harm reduction strategies for addicts with children in their household in order to lessen the burden addiction puts on families. Once addicts do come forward, there must be effective evidence-based treatment available to them, and they need to know where and how to find treatment. We know that various forms of medication-assisted treatment, or MAT, can effectively treat addiction, but current access to such treatment is woefully inadequate. Let me repeat that. Resources for that type of treatment is woefully inadequate today. Recovering addicts should have the tools and support they need to both get clean and stay clean. I hear about this problem in Illinois nearly every day. Even when people can get treatment, can get into rehab, they and their families still have no support upon release. It's not enough for us to just get them clean. We have to keep them clean. These people then struggle to maintain sobriety. I hope to hear today from our witnesses on ways to solve this problem. Finally, federal spending has to be held accountable. One of this committee's core missions, and I know Chairman Jordan agrees, is to identify and root out government waste, make sure that we're not throwing good money after bad. I look forward to hearing today how scientific evidence is being used to ensure that taxpayer dollars are being spent efficiently and effectively in local addiction response efforts. I hope today's hearing will provide a constructive conversation about what local communities are doing and what the federal government should be doing to address the opioid crisis and the disease of addiction. And I look forward to working with my colleagues on both sides of the aisle to address this public health crisis. Thank you so much.